Here's a great tip to save you hundreds, maybe even thousands of dollars on your medical expenses. And it all has to do with your doctor visits. Hey there. Have you ever gone to the doctor and after parking and registering and waiting, you finally get in to see them? They take your history, you really like them, they examine you, and then inevitably they order some kind of a test. We need a CT scan, we need an x ray, we need an MRI. And then what happens next? They write you a prescription, you leave the office, you go get the test, and then you come back. The doctor has the result, and you sit down with the doctor and discuss the result. That's terrific, right? Wrong. That is a huge waste of money. Before I tell you what to do differently to avoid just throwing that money away, let's first kind of get a look at, well, how much money exactly are we talking about? We all love our doctors, but they don't work for free. Doctors get paid based on CPT codes. For example, the code for a new patient visit, depending on how complicated it is 99204. Medicare is going to pay your doctor $187 for performing that new visit. Well, that's Medicare, but private insurance is going to have some kind of separate contract with your doctor. It's going to be at least $187. It might be more like $250. If your insurance company if you don't have insurance or if they don't have a contract, you have to pay whatever that specialist charges. And that could be a lot. For an orthopedic surgeon, that could be well over $500. For some neurosurgeons, you could be looking at $1,000 just for that visit. Well, let's get back to that example. So you had the test, fine, all of that's done, said and done. Let's say it's an x-ray that you need of your knee. When you come back to discuss that x-ray with that orthopedic surgeon, there's going to be an additional charge. I mean, the CPT code for that follow-up visit happens to be 99214. The Medicare allowable for that is $126.28. For private insurance, you're looking at $250, maybe even $500 again. That is a lot of money. And here's the thing. Depending on the problem, the orthopedic surgeon and everybody else in that office almost certainly knew that you needed that x-ray before they saw you the first time. They knew before you ever came in. Here's a tip that's going to save you that $250 or possibly even more. Before you ever go see the specialist, orthopedic surgeon, neurosurgeon, pain management doctor, call the office, tell them why you're coming in, and ask to speak to the mid-level provider. That's the nurse practitioner or the PA. If they don't have a mid-level provider, speak just to the medical assistant. Tell the medical assistant, review the reason you've been referred, why you're coming in, and ask them what studies is the doctor going to need, whether it's an x-ray, CAT scan, MRI, EMG, whatever, what test is the doctor going to need so that we can make a treatment plan while I'm there in the office. It seems like an imposition. It's not. It's a perfectly reasonable thing to ask. I can tell you, having been a practicing doctor for 20 years, I really appreciated it. I don't want to clog my office up with unnecessary visits. I want to help as many people as I can. If they don't know, tell them to go ask the doctor and call you back. And then here's the magic part. Tell them to order the study, get it done, and bring the result with you to the doctor's office. Look, does this sound intimidating? It's not. There is a lot to it. And sometimes you feel like you need to be a little more educated before you can just go out there and start making demands on these offices. And our channel really is the way to get back in the game. At the very bottom of the channel, we have a playlist for every joint in the body. knee pain, hip, well, not every joint, but the big ones, hip pain, foot and ankle, hand. Watch the playlist for the problem that you're having, and then you'll be prepared. You'll know the options so that you can go talk to the office and you'll speak their language. You'll know exactly what's going on and what the best way for you to prepare will be. Okay, you do all that. You get your everything prepared. You go in there, and for some crazy reason, the doctor still wants some other tests that nobody expected. Don't worry about a thing. With all of your education and understanding of the options, just reframe it for the doctor. Say, hey, if I understand it, doctor, you're ordering this test so that we can decide between A and B. The doctor will say, yeah. You say, okay, I'll get the test done. Is it okay if I just call you afterwards and go over? I know what to expect. You know what to expect. The doctor's always going to say yes to that. Almost always going to say yes to that. Here's the great thing. Calls with physicians, calling them on the phone is absolutely free. I hope this was helpful. To keep this content coming and get more tips like this on how to get cost-effective care, the best care, the care you deserve, but without wasting your hard-earned money, subscribe to this channel. And please enable notifications. I'm really looking forward to talking to you again soon.